Hello, my name is Jill Nyland, and this is my daughter Amy Nyland, who I lost in 2018 to a fentanyl overdose. She was 34 years old. Nobody thinks it's going to be their kid that they lose from a drug overdose, but then it happens. I made this video to make others aware that it can happen, and I want to help kids understand the dangers of drugs in this video. Here are some drug facts. Over 100,000 people died in 2023 of drug overdoses. And in 2019, 4,777 adolescents died from drug overdoses. That's almost 5,000. And the numbers are climbing. Marijuana is occasionally mixed with other dangerous substances, and young individuals who smoke marijuana have been discovered to have abnormalities in the brain related to emotion, motivation, and decision making. Here are some reasons why people do drugs. One is addiction. People maybe try a drug one time, they like it, they continue to do it, and then they get addicted. Another one is family history. Someone might live in a family where the father, the mother, the brothers, the sisters are doing drugs, and they get exposed to drugs that way. Another reason may be that they self-medicate themselves. They may have went to the hospital for surgery, came home, got some pain medicine, and then they never stopped, and they went and looked for drugs on the street. Usually after a surgery, a person should be off pain medication after 6 weeks at the most. Some people say that they do drugs because everyone is doing it, or it seems fun, or they like to relax, or they just want to fit in. A lot of times peer pressure can be a problem when it comes to saying no to drugs. Some of the problems with drugs are that you can lose your job, you can lose your family or friends could lose interest in you. They could try to help you, but then give up hope after you continue to do drugs. You can become homeless. You can start criminal activities to try to get the drugs that you're addicted to. You could drop out of school and lose all your dreams, your future. And the worst case scenario is you could possibly lose your life. Here's some problems if you smoke marijuana. These are facts. These are not just made up stories. Marijuana deposits 4 times more tar in the lungs than tobacco. Marijuana can cause memory problems, severe anxiety, hallucinations, loss of sense of personal identity, increased heart rate, which can cause you to have a risk of stroke or heart attack, and impaired coordination. Some of the long-term marijuana use problems are decrease in IQ, poor school performance, impaired thinking, addiction, potential development of opioid abuse, relationship problems, antisocial problems, stealing, paranoid difficulties, and a greater chance of being unemployed. The most disturbing thing I have seen with alcohol abuse as a nurse is liver failure. Liver failure is when the liver is unable to get rid of poisons in your body. Liver failure causes yellow skin, enlarged stomach, stomach pain, leg swelling, dark urine color, nausea, and vomiting. These are all symptoms of this condition. With liver failure, it is life-threatening if your liver has reached a point where it cannot be repaired. In that case, you will need a liver transplant and to take special medication. And still, that does not guarantee you a good quality of life. Some short-term effects of alcohol are slurred speech, drowsiness, vomiting, diarrhea, upset stomach, headaches, blackouts, breathing difficulties, distorted vision and hearing, decreased awareness, unconsciousness, anemia, and coma. Some of the long-term effects of alcohol are unintentional injuries such as car crashes, burns, falls, and drownings. Unintentional injuries such as firearm injuries, sexual assault, and domestic violence. On-the-job injuries, family problems, alcohol poisoning, high blood pressure with a possible stroke, liver disease, nerve damage, permanent brain damage, and stomach ulcers. Some more long-term effects of alcohol are low vitamin B levels, which can cause amnesia, lack of interest, and disorientation. Gastritis, which is inflammation of the stomach walls, malnutrition, and cancer of the mouth. Here are some effects of painkillers: constipation, nausea, vomiting, dizziness, confusion, addiction, unconsciousness, respiratory. This is a big one. If you take painkillers and your respiratory slows down, it makes you unconscious because you can't circulate the blood to your brain anymore, and it can cause long-term effects. I have seen patients that have become dependent on others because they're paralyzed and they damage their brain that much from taking too many narcotics and going unconscious. Painkillers are a depressant. They can make you depressed. They can increase your heart rate, put you at risk for stroke and heart attacks. They can put you into a coma, and then it can take your life. The number of people using pain pills isn't increasing. As the drug abuser becomes more tolerant of the drug, he or she will have more personality shifts. They'll become socially withdrawn. They'll try to visit multiple doctors to search for medications. They'll ignore their responsibilities. They'll have an increased sensitivity to their surroundings, which cause blackouts and forgetfulness, and they'll become defensive if confronted about their addiction. Okay, here are some photos of cocaine. Cocaine is a very, very dangerous drug. Cocaine or any drug is nothing to play with if you want to safeguard your life. Some drug dealers are putting a drug called fentanyl in the cocaine, and it will kill you. Fentanyl is a drug they use in the hospital to put you out so that the doctors can have surgery on you. My daughter died from this drug. Please do not take this drug or any drug as far as that goes. This drug is like playing Russian roulette with your life. You never know if the drug dealers put something else in the drug to make it stronger or more powerful. Cocaine is not the only drug that is laced. When people take this drug, they will sniff it up their nose. Then if they cannot get a good high, they will cook it with a spoon and smoke it. The next step that an addict may take is shooting it up their veins. This drug will absolutely ruin your life and your dreams. Some of the short-term effects of cocaine use are loss of appetite, increased heart rate, blood pressure, body temperature, contracted blood vessels, increased rate of breathing, dilated pupils, nausea, hyperstimulation, bizarre, erratic, sometimes violent behavior, intense euphoria, anxiety and paranoia, depression, intense drug cravings, panic, and psychosis. Some more short-term effects of cocaine are convulsions, seizures, and sudden death from high doses, hallucinations, hyperexcitability, and irritability. Some long-term effects of cocaine are permanent blood vessel damage to the heart and brain, high blood pressure leading to possible strokes and heart attacks, liver, kidney, and lung damage, destructive nose tissue damage if snorted, respiratory failure if smoked, infections if injected into the veins, and malnutrition and weight loss. Some of the long-term effects of cocaine are sexual problems, reproductive damage where you can't have children anymore, disorientation, loss of interest, irritability and mood disturbance, increased frequency of risky behavior, delirium or psychosis, severe depression, tolerance, and addiction. I saw the effects that happened to my daughter when she was doing drugs, and I'm not sure what all drugs she did, but she was dumb. It took her mind. She had anger outbursts, and it was almost like a demon took over her body. It was awful to see her in that condition. So drugs are very, very dangerous. They can really, really harm you. So just don't do drugs. Here is a young girl who was taking crystal meth. It probably ruined her life unless she looked for help. Yeah, it can destroy your life in more ways than one. Meth can come in several forms, crystal, powder, or pills. Most people use the crystal form and smoke it. The powder form can come in different colors, white, yellow, brown. I've heard of people that take this and then they feel like bugs are crawling all over them and they start picking their face and their skin, and that's why that girl's face looks so bad in the photo. But some of the short-term effects are loss of appetite, increased heart rate, blood pressure, body temperature, dilated pupils, disturbed sleep pattern, and nausea. Some more short-term effects of using crystal meth are bizarre, erratic, sometimes violent behavior, hallucinations, hyperexcitability, irritability, panic and psychosis, convulsions and seizures, and death from high doses. Some of the long-term effects of crystal meth are permanent damage to blood vessels that can cause brain damage, heart attacks, and strokes, liver, kidney, and lung disease, tissue nose damage if snorted, respiratory problems if smoked, infections if injected, malnutrition, and weight loss. Some more long-term effects of using crystal meth are severe tooth decay, disorientation, loss of interest, confusion and exhaustion, strong psychological dependence, psychosis, depression, damage to the brain similar to Alzheimer's. I'm going to discuss a drug called ecstasy. Here are some before and after photos of women who used ecstasy. If you look at her, you can almost conclude you would not want her babysitting for you or your brother or sister or driving a car down your street. This drug is hazardous and even more dangerous if you drink with it. Sometimes men will put this in women's drinks to make them be less in control and take advantage of them sexually. Some short-term effects of ecstasy are impaired judgment, false sense of affection, confusion, depression, sleep problems, severe anxiety, and paranoia. Some more short-term effects of ecstasy are drug cravings, muscle tension, faintness, chills, involuntary teeth clenching, blurred vision, and nausea. As you can see, ecstasy comes in several colors and printings. You don't want to take this drug or even experiment with this drug. It can take your strength, your motivation, your dreams, your friends. You could become homeless. You could have to live without money. You could lose your sanity. You just don't want to take this drug at all. The long-term effects of ecstasy are long-lasting brain damage affecting thought and memory, damages to part of the brain that affect the learning, sleeping, and motivation, You can get degenerative nerve disease, which affects activities such as balance, movement, talking, breathing, and heart function. You can become depressed, have anxiety, memory loss, and kidney failure. Some more long-term effects of ecstasy are psychosis, which is loss of reality, cardiovascular collapse, which is loss of blood flow to the heart, convulsions, hemorrhaging, and death. Now I'm going to talk about synthetic drugs. These drugs are dangerous, and I'm going to go over them so you can understand them. Some people sell these drugs and believe that they are an alternative to marijuana, but they are not legal and are illegal in numerous states. People who sell these drugs try to say these drugs are safe, but they are not safe and could cause dangerous and life-threatening side effects and even death. These drugs are sold as plant food, herbal incense, potpourri, jewelry cleaner, research chemicals, and bath salts in convenience stores and gas stations. The seller of these drugs deceive regulations of the U.S. Food and Drug Administration by labeling them not for human consumption. There are some pretty scary stories out there about kids using synthetic drugs and getting hurt by them and even dying. There are many forms of these drugs. The first one here is K2 and Spice. The seller sells it as a potpourri, but it is not. Some people call it fake marijuana, but it is more than that. In studies, these drugs have been linked to increased amount of people visiting the ER. K2 and Spice are a synthetic cannabinoid and may have other drugs or dangerous chemicals in them. Sometimes the sellers may lace these drugs with more dangerous drugs. When I say lace, I mean put something else in the drug to make it more dangerous than it already is. Some of the short-term effects of synthetic drugs are unresponsiveness, loss of consciousness, confusion, altered time sense, extreme anxiety, panic attacks, severe paranoia, delusions, hallucinations, psychosis, and potential suicide. Here are some effects that synthetic drugs do to your body. Nausea and vomiting, heavy sweating, uncontrolled spastic body movements, acute kidney injuries, rapid heart rate, high blood pressure, reduced blood supply to the heart, which can lead to a heart attack, convulsions, seizures, and strokes. Okay, here are some photos of bath salts. The same thing is happening with bath salts as is with K2 and Spice. People who are selling this are selling under disguise to violate regulations and laws. Bath salts are a very addictive and mind-altering drug. For example, when I went to Florida for a vacation, a news story came on about a young girl who was doing bath salts, and she thought she was Harry Potter. She was driving dangerously and jumped the curb, hitting and killing a federal judge and injuring a 6-year-old boy. This young girl took someone's life and most likely lost a good part of hers because she is probably facing a long time in jail. These drugs are nothing to mess around with, even just once. People and teens who get a hold of these drugs snort, smoke, swallow, and inject these drugs. If you see anyone selling any of these drugs to protect your friends, family, and community, you need to tell a law enforcement agent or a trusted friend safely and secretively. I'm going to share one more story with you. This is a financial executive. This man had his whole life in front of him. He had a nice job, he had 2 kids, he had a wife, probably a nice car, probably a nice house. He started doing bath salts, and this drug was so mind-altering that he thought that people were following him. He started breaking into cars, and when he was discovered and the police approached him, He growled at the police officers, showed his teeth, and started fighting with the police officers. And as you can see, the outcomes were not so good for him. So these drugs are very dangerous, and yeah, just don't do them. Here are some of the short-term effects of bath salts: uncontrolled craving for the drug, insomnia, false feeling of well-being, changing to paranoia, nightmares, depression, severe agitation, hallucinations, and delusions. Some more short-term effects of bath salts are self-harm, suicidal thoughts or suicide, psychosis, and violent behavior. Here are some of the effects that bath salts do to the body: skin rash, skin crawling sensations, excessive sweating, high fever, loss of appetite, sexual dysfunction, nosebleed and nose burn if snorting, and pain in the back of the mouth. You can also have ringing or buzzing in the ears, teeth grinding, muscle cramping or tension, numbness and tingling, dizziness, blurred vision, rapid movement of the eyes, chest pain, and heart attack. Bath salts can also cause headaches, seizures, brain herniation, and death. No problem goes solved without addressing it. So if you have any friends that are doing any of these drugs, the best thing that you can do is tell on them so that they can get the help that they need. If it goes unaddressed, the person that's doing drugs may get more involved in drugs, and the sooner that it's addressed is better for them to get the help that they need. This boy is a 15-year-old who had good grades, played football, and was popular. One night he went to a party and bought something he thought was LSD. LSD is a hallucinogen that alters your thinking. You can see, feel, and hear things that are not real, and it can change your awareness of your surroundings. It comes in a little tiny piece of paper where drug dealers put drops of drugs on them. Anyway, this boy bought and took an N-bomb, a synthetic form of acid, without knowing it, and it ended up killing him. Both drugs are hazardous, but the synthetic will kill you if you get the wrong one with too many drugs on it. If you're ever at a party and someone offers you a small piece of paper to put in your mouth, do not take it. N-bombs come in several forms. They can come in these little pieces of paper, pills, and liquid. The short-term effects of N-bomb are visual and auditory hallucinations, confusion and disorientation, scrambled communications, aggression, paranoia and panic, agitation, and insomnia. Drug dealers don't really care whether you get injured or not. They just want money, and your personal well-being is not any of their concern. But in this photo, it looks like they just put the paper in the pipe and smoked it that way. But some of the effects on the body are shaking, nausea and vomiting, fatigue and loss of consciousness, muscle spasms, difficulty breathing, high white cell count, rapid heart rate, and high blood pressure. These drugs are very dangerous, even for cops that go to confiscate it. They have to wear gloves and gowns, especially if the drug is in a powdered form. So if somebody hands you a little piece of paper at a party and tells you to take it, don't take it. Flush it down the toilet and wash your hands without putting your fingers in your mouth, because you can transfer the drug into your system. Some more N-bomb effects on the body are high levels, which can lead to coma and death. high fevers, seizures, involuntary flailing and thrashing, kidney failure, heart attacks, respiratory failure, and bleeding in the brain. All of them are pretty dangerous. So yeah, just don't take this drug at all. Here are some before and after photos of heroin users. As you can see, it's nothing pretty. Drugs will rob you of your beauty, your mind, your possessions, and it just basically takes your life away. It takes away your innocence, it takes away your well-being. It just takes everything from you. Heroin is the same as cocaine. They can snort it, smoke it, or inject it. This is a part that scared me when I was a teenager and learned about this. One thing was the tracks in the arms. When you shoot it, you ruin your arms. And being homeless, that's a real scary thought. And as being a nurse, I seen drug users use drugs, and it's common for if you shoot up drugs for infections in the arms, and of course you can infect your heart to the point where you ruined your heart valves, and it can be life-threatening and to the point where you need surgery. Another thing is people don't want drug addicts living in their house, so even your parents will kick you out of the home because you're so addicted and you won't help yourself get better. So it's not a glorious sight. It's not glamorous at all. It's a hardship, and once you start doing drugs, it's hard to withdraw. You really should not do drugs. Just do not do drugs at all. Some of the short-term effects of using heroin are getting a rush. Your breathing could slow down. You get clouding mental function, nausea and vomiting, sedation and drowsiness, and hypothermia. Heroin short-term effects are rush, slowed breathing, clouding mental function, nausea and vomiting, sedation, drowsiness, and hypothermia. The long-term effects of using heroin are getting really bad teeth, constipation, cold sweats, itching, weakness of the immune system, coma, and respiratory illnesses. Another thing about using heroin in the long term is that people are dying from it. The more you do drugs, the more you put yourself at risk for getting a bad batch where drug dealers are mixing and lacing other bad drugs in with it. And so you're risking your life. You really are. You're playing Russian roulette with your life. It's something you don't want to play with. I saw this video from this rehab place where they don't give you drugs to counteract the drugs that you are trying to withdraw from. And I found it very interesting because of the story on how they explain how drugs affect your body and your mentation as far as focusing. So I just wanted to share that with you. I also wanted to say that even though you maybe want to get better and go to some recovery after maybe starting drugs, there's all kinds of problems with that. If you don't have insurance, you might not be able to get into a rehab center, or you might have to take something to stop you from having seizures, because that's one of the side effects of withdrawals from drugs. So it can be very dangerous to withdraw on your own with some of these drugs, especially if you're drinking alcohol. That's very common for you to go into seizures and you need help withdrawing. You can also go into hallucinations and seeing and hear things that other people don't hear and see. So it can be dangerous withdrawing from drugs and alcohol. The best solution to this is just not to do drugs at all, and don't get yourself in this circumstance.